This is rheumatoid arthritis affecting the hand. Notice all the fingers are bent towards the pinky. The fingers are stiff to move, not being able to make a full fist. Worst of all, the fingers cannot come out straight, making it hard to perform basic functions of daily living. Rheumatoid arthritis is an autoimmune condition while our own immune system destroyed the joints of our hands. This condition particularly targets the knuckle joints as well as the tendons that straighten our fingers. Over time, the knuckle joints became dislocated and the tendon falls to the side, pulling the fingers away from the thumb. So how do we transform a deformed and disabled rheumatoid hand on the left to a straight and functional hand on the right, within only 2 weeks of treatment? This is the result of knuckle joint replacement using silicone implants. Incision is made on the back of the hand over the dislocated knuckle joints. The arthritic joint surface is removed on both sides. A broach is then used to create space within the bone to accommodate the appropriate sized implant. The joint is now relocated, and the tendons are rebalanced to help straighten the finger. The same procedure is then repeated for all the affected fingers. The hand is out of the cast after 2 weeks to encourage early movement. The hand therapist will apply a splint for another few weeks for protection and swelling. At 6 weeks after surgery, the swelling are reduced and patient has regained full movement and function of the hand. The fingers are now fully straight. There is no problem with a full grip. The surgical incision across the back of the hand is healed nicely and the patient is very happy with the outcome. Thank you for your attention. Please subscribe and leave comments below.